Hi. So, what exactly happened last month? Well, it is kind of a long story. So, if you're interested, then please bear with me. I've been dealing with heart failure for about a year now. My cardiologist at Upstate, Dr. Mukherjee, he let my heart failure go, saying, "Oh, we'll just keep an eye on it." Just for some perspective, my mitral valve gradient, which is the pressure on that side of my heart, was at a 12 last August when they did an echocardiogram. In February, it went all the way up to 35. And somehow, maybe because of LASIX, it went down to 25. Now, surgeons start operating when your gradient is at a 10. And for good 7-ish months or so, it was well past that. So it was very difficult to breathe. I got tired very easily. Finally, when I had enough and realized this, I called Cleveland Clinic. I had my mom call Cleveland Clinic too to kind of expedite surgery. And Cleveland Clinic is the number one hospital for heart failure, for heart surgery. So I went through Upstate, got all my records sent over. We made the drive. They did their own testing. And May 11th was supposed to be my surgery. But with some blood tests, they realized it was hard to find a blood donor. It was hard for the American Blood Bank to find a match because my blood has so many different antibodies. Most people have like one or two. The surgeon said I had like a city worth of antibodies. Like it's a lot. So it got postponed for 5 days while the blood bank tried to find a match. And luckily they did. Because May 17th is when I officially had surgery. And it didn't go as planned. Not in the slightest. As soon as the surgeon, Dr. Burns, which I highly recommend, if you ever go to Cleveland Clinic, Dr. Burns is amazing. But as soon as he put the mechanical valve in my heart and started my heart back up, all the blood, and I mean all the blood, went right into my lungs. The average human body has about 5 or 6 liters of blood in their body. And I had 5 liters of blood go into my lungs that he needed to suck out and then replenish with, thank God, they found a blood donor. They got, well, not a blood donor, but they had blood waiting for me. And to prevent that happening again, they put me on a machine called an ECMO, which they did through my femoral arteries. Basically works like a bypass machine. Takes blood out of your body, oxygenates it, then pumps it back into your body. I was on that for a good 2.5 days. And because my lungs were so inflamed, he couldn't close my chest up for 3 days. So that's another reason why I was on ECMO. And yeah, I was asleep through it, thank God. By the third day, I guess the swelling went down. And he was able to close me up. So there I was sitting in ICU with an open chest. They put bandages on it, of course. They filled my body with antibiotics, for 3 days or 2.5 days. But yeah, they eventually closed me up. But due to the antibiotics, I developed C. diff. If you don't know what that is, it's basically bacteria that we have in our bodies that we have other bacteria that keeps them in check. With the antibiotics, it kills off all the good bacteria, only leaving the C. diff. And when that gets out of hand, you do nothing but basically shit. It's liquid, it's bad, your stomach swells up, and it's constant. It's like diarrhea times 10, best way to describe it. I got marks all over my body because I had tubes all over my body. I had tube up my ass because of the C. diff. That went to a bag. I had a catheter, a Foley catheter, which was not fun when they pulled out. That hurt. If you can see all these scabs right here, if you have heart surgery, they give you chest tubes to help drain out all the fluid in your heart. I was basically in a chemically induced coma for 12 days. Because I think on day, I don't know what day, probably 6 or 7, they woke me up. They took me off of the breathing tube that they put in my mouth. And then I didn't last long. My dad says about a half hour later, I went into respiratory failure. Basically, I couldn't breathe. I was suffocating. And I remember bits and pieces of that going on. I remember fighting the doctor. I went from being very sedated to suffocating. They try to intubate me the regular way through the mouth, and I was choking, I was gagging. They had to put a rescue bag, that they squeeze with the mask on my face, and I woke up, the bag was right here. I passed out again, woke up again, the bag was right here on my face. So I must have been fighting the doctor. The metal tube that they put in your mouth, not a tube, but some type of instrument that opens up your mouth. I remember the taste of that. I remember gagging on that. I remember trying to take a breath in and, not being able to breathe. It's the worst feeling ever. But I think they eventually sedated me and put a tube down my throat to help me breathe again for like 2 more days. Because they can only do that for a maximum of 9 days. And after that, they cut a hole in my neck and hooked me up to a ventilator through my trachea. And I was on that for another, I want to say, 1.5 to 2 weeks. But I remember hallucinating afterwards when I was in and out of the coma for 12 days. I hallucinated at my first surgery 10 years ago, but they were fun hallucinations. This time they weren't. it was basically nightmare after nightmare. You know, they weren't fun. Probably the worst was an auditory hallucination where I just heard this really loud bass music, this and it was just getting louder and louder. And that eventually morphed into like a loud mechanical sound, almost like a, I don't know, fire alarm. But that was going off what seemed like for hours. Eventually I was going crazy. I remember a nurse like coming in and telling me, "Oh, you have to stay in bed." And I just went like this. And next thing I know, I think she gave me some type of IV medicine. But after that, like the noise started decreasing in volume. It kind of dissipated away. And I think I went back to sleep. I eventually did wake up, only to see my parents, which I was so happy to see. Because coming in and out of the coma for 12 days I was heavily sedated. They gave me so many meds. And I'm talking like Seroquel, Buspar, the fentanyl, among others. It's not fun. Not fun, but I was so happy to see my parents. I gave them big hugs when they came. Because I didn't really see them when I was asleep. They say when you're in a coma that you can still hear people. Now, I remember one hallucination or dream that had my mom in it. One that had my dad in it, but that was a nightmare, basically. But your whole perception of where you are and what's going on is totally off. I thought I was at a restaurant with my mom. Another time, I was at a drug house with my dad. I thought I was able to bend time and create a loop and be able to be here at my house and then jump through my phone and be back at the hospital. It was crazy. Everything is just bent with all those meds. And some of it is your body reacting to the trauma it experienced during surgery. All right, so I woke up, had the ventilator still hooked up to my neck. I couldn't talk. They tried to give me a whiteboard to write, but my handwriting was illegible. So my mom gave me my phone, and I still have it on here, and I would write on my phone and talk to them that way. Talk to the nurses that way. So the C. diff eventually stopped. They pulled a tube out of my butt, and they don't do it gentle. Like one thing about Cleveland Clinic ICU, they do things as quick as they can to get the pain over with, I guess. And did not feel comfortable. When they took the catheter out, the Foley catheter, that was not comfortable either. My dick hurt for a good 3 weeks after that. I had a feeding tube up one nostril, which they fed me, liquid food from, that they also gave my meds to. And they tried putting an NG tube in the other nostril, and that was very, very uncomfortable, very painful. About 15 minutes later, I had him take it out. The NG tube was to help relieve all the gas in my stomach, but I told him I'd rather just deal with it. So they had me on the ventilator. They weaned me off it. Ventilator's weird. I tried to fight it a few times just to see how it worked. I tried holding my breath, but I guess they force air into your lungs. Because I tried to hold my breath, and it's like, no, you're breathing. Then they wean me. How they wean you off it is they do something called a CPAP. And then after CPAP, they try to close it up, and a couple days of CPAP, which is, from my understanding, just like regular air, and it'll kick the ventilator on if you stop breathing for 20 seconds. And they eventually took me off of that, and then they put a cap on the vent so I could talk. And then oxygen through my nose, and 3 days of that, and they were able to take the tube out. And they closed it up. Now, quite a few times since I was, how am I going to say this? Now, being bedridden for 2 weeks, I couldn't stand, couldn't walk. They have a special team called the lift team. You have these two big muscular guys, and their job is to lift you off the bed and put you in the chair that's right next to it. They had to do that for the first 2 or 3 days till I was able to stand. First waking up through all that. I was very dizzy. I couldn't stand. I couldn't move. Without losing my balance and falling over. But the more times they had me in the chair, I was able to get my bearings. I eventually was able to walk. There's pictures of it. With a walker, with everything hooked up to it. Heart monitors, and whatnot. IVs. I got so many holes in my body. So I walked with the walker a few times. Then I eventually got taken out of ICU into a different room. So I spent a good amount in ICU, and most of the nurses knew me. And when they wheeled me out, all the nurses clapped for me. It was really awesome. Oh, before I left ICU, another speed bump. It was complication after complication, this surgery. But another speed bump was I developed something called Afib, which just out of nowhere, my pulse was regular. Then one night, it just spiked. It jumped up. Afib is basically an irregular heartbeat. The muscles in the top part of your heart, they basically twitch and flutter. And it causes irregular heartbeat. My heartbeat would go from 90 to 120 to 100 to 130 to 148 to 150 BPMs, and it would just go up and down, up and down. So in order to control that, they had me on an IV med, but they eventually shocked my heart, with the pads, with the electro pads. They had one in the front, one in the back. They knocked me out, and then basically jump-started my heart. And that fixed it. My heart rate from then on has been steadily in the 80s. And then I got brought down to my own room, where I stayed for another 3 days, or 4 days. 3 to 4 days. So that was basically my experience. Wow. Long story. And while I was in my own room, they had me walk more. I walked more every day. Afib stayed under control. I don't have Afib anymore. I was able to walk on my own without any supervision for a while. C. diff went away. Chest is closed up. It took a while, but everything eventually worked out, which I'm thankful for. And I'm truly grateful for everybody that checked up on me, that kept me in prayer. I try to update you guys as much as possible through Facebook. But yeah, it was a hard time. When I went in respiratory failure, my dad said I was flopping like a fish. The doctor that basically rescued me said it took 15 years off of his life. High stressful situation. Which the teams over in Cleveland are just great. All the nurses rushed in there. In ICU, I had some of the best nurses I've ever had. They're willing to help you out with anything they could. Really, really caring. For sure. So I definitely recommend Cleveland Clinic because they saved my life. Some people in ICU weren't so lucky. There was 2 people waiting for lung transplants that died of COVID. They weren't vaccinated. I know some of you guys are anti-vaxxers, which you have your reasons. I get it. But knowing that 2 people dying from COVID because their lungs weren't working. They weren't smokers. They didn't have any previous conditions either, but they didn't make it. And what was also scary, I had the patient next to me in ICU. He almost coded like I did. All the nurses and doctors were in there. He had a lung transplant as well. There was a lot of people in ICU having lung transplants for one reason or another. But they gave him like a vasodilator and his blood pressure just plummeted. So they called all the nurses in. The doctor stayed in the room, called the crash cart. It was being right next to it definitely triggered some PTSD from when I coded, when I went into respiratory failure. So anyway, I got a mechanical valve put in my heart. I can hear it clicking all the time. So that takes some getting used to, but I'm lucky because I'm recovering a lot faster than I did 10 years ago. I can walk more. I can exercise more. Well, when my chest heals, that is. Going through cardiac rehab next week for 12 weeks. I think 2 to 3 times a week for 12 weeks to strengthen up my heart muscles and to basically recover faster. I'm definitely blessed to have the people, helping me out. Thank you to everyone that donated on the GoFundMe. I have a benefit coming up as well, July 17th. There's tickets for that. The number is on the flyer if you see it around Facebook. But yeah, I've had a lot of people help me out, and I'm truly grateful. So thank you. That's my story. That's what happened last month. Well, thank you guys.